to the channel. So in this video, I have a very special topic to bring to you guys today, and I'm so excited. It's so funny how God brings people into your life. It's just amazing to me. So anyways, I met Nicole. She is such an amazing person, and we're both clinicians. And the other day we were just talking about how it is so valuable to be a clinician. We're going to talk about the benefits of being a clinician and being a Medicare broker or a Medicare agent for our clients. I've always wanted to discuss this, but I just haven't found the right person or just the right words. You know, she puts it in like perfect words. So I'm so excited to bring her on. And another thing that I want to just briefly talk about is that it is so important to network with people that is in your industry, okay? To help build each other up and help strengthen each other's businesses, especially if you're doing something independent. A lot of background noise can be happening. A lot of people can be talking in your ear, making you feel like this is something that you cannot do because people are so used to working a 9 to 5. So I am so grateful and so happy that I am able to build a network of friends that is also doing this as well, and we could help each other build each other up, because at the end of the day, it is definitely enough for all of us to be successful. So anyways, I'm going to introduce you guys to my friend Nicole. I got this new camera, I just have to say this. And I don't know where I'm looking in the camera, but I'm not looking where I'm supposed to look. So just forgive me. Just pretend that you don't see my eyes wondering. Just pretend that you don't see that. Let's continue on with the video. Hi guys, welcome back to my channel. So I have a special guest today. Nicole, introduce yourself.
Hi, my name is Nicole Morgan, and I am an occupational therapist, but I'm also a Medicare insurance specialist agent. So I left, so that's kind of short version of the introduction there.
Yes, so how do we meet Nicole? So Nicole basically slid in my DMs. At first I was like, who is this girl? Then she left me a message, and she was just so sweet, and I had to talk to her. And when I found out she was an OT, I was like, oh my gosh, like I feel like nurses, you know, us in the medical field are looking for a way out. And I feel like this would be a great conversation to bring to you guys, to bring to healthcare workers the benefits of becoming a Medicare agent, a Medicare broker. So I know a lot of people, like I said, is looking for a way out of the healthcare profession. And this is definitely a way out, okay?
Yes.
So what are some of the benefits of being a clinician and being an agent? What do you think?
Well, I have 20 years in the healthcare industry, and I believe that, you know, just my experience with the patient, diagnosis, prognosis, the understanding of medications, all of that plays into helping someone choose the right plan. So yeah, the insurance industry is another industry to learn, but Medicare is super easy for us as clinicians. We've already been there on the front lines. We've documented to Medicare. We understand what Medicare is requiring. We understand how to navigate the healthcare system. And so when someone gets caught with a billing issue, or they get caught in you know, just the process of things, I think our background as clinicians brings a sense of security to our clients that are 65 and older. To me, it's been an automatic trust with my clients, because I've been there. I've been there where they haven't been yet with other people. So it makes them feel in a way secure. We understand as clinicians the whole language.
Yeah, I totally agree with you. I totally agree with you. One thing I would say though, I personally have not been selling myself as a registered nurse, you know, so, and I know you have talked to me about that as well. And how important it is to sell that, because it is very important. Because a lot of times when I give out my business card, they like, oh, you're RN? I'm like, yes. So I don't really sell myself. It's just already on the business card, but I don't really sell myself. So what would you say some key points to sell yourself as a healthcare worker?
Well, like I said, you already have that experience on the front lines as a clinician, and no offense against any other agents that are, especially the ones that are out there that are really successful and that have a real passion for the industry and a very good connection with all their clients. But we're not just any other agent. We come with a different kind of knowledge that helps people now and in the future. We understand what they're going to be going through once we see their list of even medications. And so exactly. I just think selling myself as a clinician first, and that's what I tell my clients. That's my first love. I mean, just because I'm an insurance agent now doesn't mean I don't love all of my patients that I did see, or that I, if I wanted to go back to the clinic, that's my first passion. And so I'm rolling that passion into helping them find the right healthcare plan for them. Because what do we see as clinicians? We see that someone put them in the wrong plan, and we see that they need some kind of clinical help and they can't get it, or they hit a brick wall with the wrong plan that was chosen for them. Clinical understanding helps us in choosing the right plan for someone, even more so than someone that's even brand new to the whole industry. I'm new to the insurance industry, but I'm not new to people, and I'm not new to holding their hand and guiding them along. You do it as a nurse. It's just we're transitioning from having patients into having clients.
Yes, definitely.
So
I remember I was reading a post the other day. Someone was like, are you afraid to go into people's homes? And I'm like, I was a home health nurse at one point, right?
Yeah.
So being afraid to go into someone's home is definitely not a problem with most nurses, Right. That's how I started out. I started going into homes. I was actually doing peds, and I did adults as well. But my first love was peds, going into the homes. And you go into these homes and they need you, like they need the support, because a lot of times a chronic condition can have a big impact in a home. It could cause dysfunction. It can cause just a lot of issues. And just having that one nurse that's going to come in and brighten their day, or hold their hand, or tell them it's going to be okay, or that nurse is at the bedside because grandma is passing away. There's nothing like a nurse as an agent walking into those homes, because we're used to the COPD person that smokes, we're used to the cat lady. We're used to all of that.
So I know, I've been there. I've been there.
So I feel like we are used to all of that. So I feel like one-on-one, the touching of the hand, saying it's going to be okay. I literally seen a client, last weekend, went to go see her, and her husband was in the hospital. And I just stopped. I took off the Medicare Agent hat and I put on the nurse's hat right then and there. It was like, can I give you a hug? What can I do? Like, what is it can I do to help you? Because I am a nurse. So yeah, I feel like being a nurse helps in so many ways as being an agent, for sure.
Yeah, we're allowed to wear multiple hats, and I've done the same thing as you. I've taken off that agent hat and put on the clinician hat, and helping guide people to services that they need in healthcare. My background is part of my background is helping people age in their house forever, redesigning spaces in the home so that someone with a disability can be functional and independent. So I have a couple of clients now that once I signed him up for Medicare, then they came back to me and they said, Nicole, I've been diagnosed with supranuclear palsy. which presents like Parkinson's. And so now I'm pulling in all of my resources, and it happens to be another client, a contractor that I worked with. He's now on Medicare. And so we are working together to redesign his space so that he doesn't have any more falls, and that he can, take a shower without falling.
Yeah.
So it helps tremendously.
And I feel like that
sense of security, that's what I feel is the most beneficial. Because like you said, being a nurse and at the bedside, or just holding someone's hand, understanding their emotions, transitioning to Medicare can elicit a lot of emotions on people. It's a transition, it's a life change, and it's very uneasy because Medicare is so confusing in itself. And it's a government program, so I feel like being a clinician, we come with the patients to help people step by step in Medicare.
Yeah, definitely. And I'm also seeing like videos of, now this is like the other token of it. I've seen videos of nurses trashing the Medicare Advantage, and it just makes me feel sad to see a nurse do that, because let's all face it, Medicare Advantage, Medicare Supplement, right? Which is better? Like, it's really about that client. What's best for them?
And it is right. And I get that a lot. I still am very connected to the healthcare community, a lot of physicians, and so a lot of them are my referral sources now. But there is a disconnect, and there is a misunderstanding. And even I came in with a misunderstanding about Advantage. Is it for everybody? No. And do you get some flack with clinicians that are, they're having to bill and they get a little slow down, maybe because it is an insurance company, but it is a good fit for a lot of people. It's the only fit for them. And another thing too is the reason that they're getting probably so much heartache with it is that person that signed up for it, they didn't have an agent that educated them properly. And as a nurse and as a clinician, as an OT, what's the first thing we did with our families and our patients? We educated them first about their diagnosis, their situation, and what they can do, what they can't do. That's the groundwork for everything, is education. And so, and not a lot of healthcare practitioners that are practicing, they don't understand the full picture. Like we've gained now being in the insurance industry.
Yeah, exactly. That plan of care. What is the plan of care, Because yes, Medicare Advantage is a managed care plan. The insurance is going to manage your care. It's going to help you with that process. And I feel like you said, agents put people on these plans and they don't explain that piece of it. So if you don't know that piece of it, of course you're going to get upset if you don't get, 26 days at the skilled nursing facility after a fracture or whatever the case may be. Of course, right. The managed care, the insurance company is going to manage your progress. You have to send clinical notes and all of that, but that's not explained to the clients.
Right. No, it's not. And so they feel like they're blindsided on it. And so I guess how I approach a client now is I don't just approach them and educate them about a plan that work for them now, because a lot of them are healthy and they're not looking to the future. And a lot of them don't want to talk about that, but I present that to them. You got to plan for now, and you got to plan for the future. And so having that healthcare experience allows me to give them real life healthcare scenarios of situations that I have been in personally as a clinician dealing with the insurance. And I know you've had some experiences like that too. Managed care, you may not get as many visits as you want, but you've got to make the most of it. It really doesn't help the client, when the other healthcare practitioners don't quite understand it, because that client may be in an Advantage plan and they'll never get a supplement. I have a lot of healthcare, friends that like, can you put them on a supplement? I'm like, no, I can't. They can't get it now. We have to make this work. So I try to educate as many healthcare friends as I can so they don't go into it with a bad taste in their mouth.
Yeah, definitely. I feel like education is always the key. Always the key.
Absolutely. Absolutely.
So what would you say to a healthcare provider that's watching this video and they actually want to get into becoming a Medicare agent? Like, what tips do you have to offer? Like how to actually start the process thinking as a agent and having the clinician hat at the same time?
Yeah, you do have to change your thinking. You have to open your mind as to what all that's available. And it's an educational experience. You learn it a little bit differently because I've actually put doctors on Medicare. I've talked to CEOs of hospitals and they don't know all about Medicare. They don't know all the ins and outs. They don't even know how to sign up, So, just open your mind. You're going to learn a lot of things that you did not know before about insurance, but keep a very open mind. But I would say is find that someone, if you even think that you want to get into the insurance industry, I would say that it has come fairly easy for me, believe it or not, to transition out of healthcare and into insurance. But find that mentor. Find that someone that you trust that will be truthful and guide you the right way in the insurance industry. Because I do think there's a right way and I do think there's a wrong way and I think there's a shady way.
Yeah, I definitely agree with you.
Yeah.
Okay. What about someone that is in the healthcare field, but say they're a certified nursing assistant, maybe a patient care tech? Maybe they don't have that level of experience as a registered nurse or a PT or OT, a speech therapist. What would you say to those clinicians?
I think it's the same. I think people in the healthcare industry are there because they love people. And I think this clientele, this demographic that we're working with, 65 and older, and even the under 65 with disability, you're in healthcare for a reason. You're there because you love people. You love healthcare, and picking the right healthcare plan, it goes right along with it. So I think it's not just for speech therapists, registered nurse. I think it's a great, if you want it to be a second career, an addition to what you're already doing. I think it's a great, in fact, I have a friend now who is a physical therapist, and he was on my clinical team at a large home health company I was working for. And I chose him to be he was on a clinical team that went into assisted livings and to treat those particular patients there. And we have just remained friends, and he's still working. In fact, he's mainly working in pediatrics, I believe. And he's doing insurance now on the side, brand new to it. And we kind of did that at the same time, not knowing that each other was doing that. But I feel sure that eventually we will, because he's near my area, eventually we'll work together. But any clinical knowledge gives you just that little bit of and that little bit of a different take on fitting someone with the right plan, I think.
Yeah, I definitely agree with you. Definitely agree with you.
Yeah.
So is there anything else you would like to add? I think this was a really great video. I cannot wait to edit it and post it.
I mean, Medicare, it was changing when I was in, and you're already, I think you're still in it, as a clinician, but it was forever changing, and it's going to forever change with our clients, when we have to tell them that, you got to be prepared. Medicare is going to change. Just stay with us. We're going to help you along the way. It is what it is. there's not a lot we can do. You know, it's kind of out of our hands, really. I just think, you know, if you're a clinician watching this, there is another alternative to keep doing what you love, and that is helping people. And that's what I have the utmost passion about. And, you know, honestly, helping people in this industry, you can do what you love and make a lot of money doing it.
Yeah.
And it's honestly, it's easy for a clinician. You're just learning a different business. You're just learning a different way of doing things, really. And there's rules and regs, just like there is with every field, you know. But I have learned to, you know, in transitioning my thinking out of the clinic, and I have learned, I found a niche for me. I'm still getting to help people. I'm still getting to educate people. I'm still getting to even, I mean, just help people understand the right way to do things, the right way to talk to their doctor, you know, and I'm still establishing that same trust as I had with my patients. So I love it. And I have a huge passion for it. And you know what, the way I think about it is if it is to be, it's up to me. That's a quote that Zig Ziglar always said, and always stuck with me since I was little. And I want to be that different agent. I'm out for what people experience and what they feel. I don't want them to be confused about what I've recommended to them. I want them to feel solid and secure about what they have chosen, whether it be a supplement or whether it be an Advantage plan, because I know if I can get that from them, that security, they're going to be real happy, you know, and they deserve that. They deserve to have a truth speaker, basically, as an agent, because I do think there's a lot of people in the industry that are not truthful with them, but they don't understand where that person is coming from, really. Whether it's an X-ray tech, whatever. I mean, you just have an advantage of your knowledge of the industry as a whole in healthcare.
I feel like we have always been advocates. When we graduated nursing school or OT school or whatever, you know, PT, OT, we took that oath. And we will always be residents or patients or clients advocates. As nurses, I feel like we are, or healthcare providers, we are one of the most trusted industries. And I think, you know, becoming a broker, and that's just something added to the industry. Trust.
Yes.
Integrity.
Trust. That's right. That's right. Because they don't get it. They get bombarded. You know. I mean, I've had people, that's not going to go away.
It's what we taught at first, right? We don't care about their insurance plans. We don't care if they have money. We just want to care for them.
That's right.
We just want to care for them. That's it.
That's right. And we want them to feel that from us. And so I have to call them clients now, but I did at the very first, I called them my patients, you know, because they're my people. And that's what I call them. They're my people.
Yeah.
And I have a lot that I'm taking care of. I have a lot on a treatment plan, basically. That's their healthcare plan, you know. I know I'm talking. Yeah. I'm talking to another nurse friend right now, and we worked at the same home health agency, and she was a branch director. I mean, she was way up in the company, and she got out of the clinic, and I don't even know what she's doing now, but because of her passion for people, I just think it would be an awesome fit for her. An awesome fit.
I totally agree. I have talked to several nurses too, and I'm like, you have no idea. You're in the right alley for sure.
Yeah.
I feel like we was definitely like, if you want to get out of nursing, this is definitely the way to go. 100%.
And you can still, your education that you've earned, your experience is all valuable in picking a healthcare plan for somebody. In fact, I think we put more thought into it, because we put a lot of thought in those treatment plans that we wrote. I mean, we really thought about it. How do we get somebody from point A to point B? And so considering their healthcare plan, we're going to put a lot of thought into it. We're really going to take into consideration those medications, because some of those medications are going to have long-term effects, or they're going to turn into something else, or we know they're dealing with something, a diagnosis that's going to have a long-term effect on them that may debilitate. We just can evaluate a little bit more in depth, I think, than your average agent. I think that's to our favor for our clients.
Definitely, 100%. I totally agree with you. All right, Nicole, thank you so much. It was really nice having you. I'm so excited.
Yes, I can't wait for the link to come out, because
I know, right? I can't wait to work with you, girl. I have no idea. I just cannot wait.
You start putting RN and you tell people I'm an RN, and that's my first love. That's my first passion, is people and caring for people. So now I'm going to care for you and about your healthcare plan. Now I have the license to do that too.
I like it.
And yes, you're exactly right. You take off that agent hat at times and you put on your clinician hat, because that's what they need. You do what that person needs you to do.
Exactly.
Yeah.
All right. Thank you so much. All right, guys. Thank you so much for watching. I definitely feel like Nicole brought a lot of value to today's video. So I'm super excited to share the information with you guys. Tell me what you think. Let me know in the comments below, guys. And definitely go out there and network with other independent brokers, insurance brokers, become a broker, find you a mentor, and all of that good stuff. Thank you so much for watching, guys. And always peace and love.